Big health news at this hour. Now, if you've been feeling unusually under the weather lately, you are not alone. Hospitals across Delhi NCR are now reporting a sharp surge in a flu-like symptom. More than half of the cases are outpatient departments in various hospitals are of high-grade fever, chest congestion as well. But this time, it's not your regular season flu that comes with the change of the season. Doctors have identified a new virus strain. It's called H3N2 influenza A virus, a specific and more severe strain of a flu that's currently dominating this year's outbreak. Now, patients with persistent high-grade fever, sore throat, body aches, headaches, and extreme fatigue are finding out that their regular medication, the go-to ones like your regular paracetamols, none of them seem to be working. Now, unlike the common cold that wraps up in about 3 to 5 days, your immunity kicks in, you start to feel better all over again, H3N2 can linger for a week or even longer in some cases. Can even lead to hospitalization due to complications like lung infections going up to pneumonia. Now, what sets H3N2 apart is its resilience. It brings with it a stubborn cough, a low-grade fever that just won't go, and a crushing fatigue. Some patients are even reporting symptoms that stretch out for almost 2 weeks or so. Now, doctors have pointed out that an extended monsoon season is partly to blame for this, but the moist conditions and poor air quality make it easier for respiratory viruses like H3N2 to sort of spread rapidly. The worst affected in this are children, especially vulnerable due to the exposure in schools and daycare centers. Their developing immune systems make them easy targets as well. And beyond the regular symptoms of fever and cough, children are also at risk of complications like a ear infection, even going all the way to bronchitis. So, we've given you all the details, but there is no need to panic. What you need to know is when to raise the alarm. The timing is critical. Now, if your fever lasts more than 3 days, you have cough that is getting worse, and you're experiencing breathlessness of any sort or heaviness in the chest, please talk to your doctor. Do not stick to just home medication. Also, at this point, and which is true for any flu for the matter, prioritizing hydration and rest, that also makes a whole lot of difference along with bringing in urgent medical attention. So that's all you need to know about H3N2, but let's also cut across to my colleague Milan, who's been tracking all the developments on this one. Milan, how many cases do we have in Delhi NCR at the moment, and what are the doctors saying? This is not the same strain we had last year around.
Well, Sonal, looking at the conditions in hospitals, I can tell you that in each of the hospitals in Delhi NCR, if 100 cases in an OPD are present and are complaining about common flu, cough and cold, 70 out of those cases are turning out to be of H3N2. And there has been about a 20% rise in the cases of H3N2 as compared to last year. So that means that 70% of the cases in these OPDs are now on H3N2, which is quite alarming. There has been a change and shift because the last year, Sonal, we had seen cases of dengue as well as chikungunya fever, etc., along with H3N2, but this time majority of the cases that are coming in with a sore throat or blocked nose, congestion in the chest are all H3N2 is what doctors have told us. So you can quite well imagine that not just government hospitals, but even in private hospitals, there are OPDs that are inundated with the cases of the H3N2. And of course, as you mentioned, children are also getting affected. So even in pediatric OPD, where you know there are some cases that are requiring hospitalization as well. We don't want to create panic, but of course, if a child is showing these symptoms, going to the doctor straight away should be, you know, the key.
Right. Let's actually bring in the doctors now to get more perspective here. Dr. Bharat Gopal, Senior Director at Pulmonology at Medanta, is with us. Also with us is Dr. Madhvi Bharadwaj. We'll get a perspective on pediatricians from her as well. Dr. Gopal, I want to come to you first. Is the treatment of H3N2 any different? Like I said in the opening as well, the symptoms are pretty much common, but if it's lingering more than 3 days, you would advise people to ring up their doctors, figure out what's happening?
So, thank you for online is something which probably everybody needs to understand. This is part of the common respiratory viruses which are there every year. So
Okay.
no need to panic. The secondly, you would be surprised to know that this is one of the strains in the vaccines which are already in place for many years for the influenza control, right?
Okay.
So it is not a new strain. So please, everybody understand this is something every year we have different stages of influenza
Yeah.
viruses which peak, and that is how the epidemiology goes. What about the questions you asked? See, there are two different subtypes: young people with no illnesses or even elderlies with no comorbidities, and people of any age group with certain comorbidities, patients who have diabetes, patients who have heart diseases,
Yeah.
patients who have leukemia. So there is a separate group. That group has flu symptoms, has to talk to their doctors immediately. The reason is that there are, and the flu medications tend to act best if they're started within the first 48 hours.
Correct.
Beyond that, it is self-healing. So young people, the timing which you said, 3 to 5 days, fine. If it doesn't get better, or if he has excessive coughing, there is blood in the cough, there is breathlessness. I think those are the danger signs. Like we used to tell for COVID, that those are the times when you need to come and talk to your doctor. So there are two different aspects. People who are already having diseases, they have to be more vigilant. They are unvaccinated. They have to reach actually earlier,
Yes.
because we can start the medicines which can prevent hospitalizations.
Right. Dr. Gopal, off late, in fact, ever since the pandemic, we've sort of noticed that any kind of cold goes beyond a week. I have witnessed it personally. Everybody complains as well, but these days, the cold doesn't leave you very soon. Is that the only sign that one should watch out for? And what I asked you earlier, is the treatment any different?
Yeah, so I'll answer both the questions. What you said, as doctors, we have also observed that I think there is some mutation in these viruses which have probably now the symptoms are slightly more. Maybe the way our body is reacting to them, the immune reaction which we are raising is slightly different than what it used to be. And maybe we are more vigilant now post-COVID. Secondly, what you told about the treatment, well, as I said, the influenza A group as such, or influenza virus group, will have only one treatment as far as the medicine goes, and that has to be started within the first 48 hours.
Got
Rest
it.
of it is all symptomatic. Rest of it is all watching and treating any complications. So those are two different. It is not any different. You don't have a specific medications for H3N2, and you don't have any specific guideline to actually monitor H3N2.
Got it. Dr. Gopal, I have a question on vaccine as well, but let me bring in Dr. Madhvi Bharadwaj here.
Sure.
Bachcho ka doctor, as she's known as very famously on Instagram as well. Dr. Madhvi, this is the season where mothers are very paranoid. There is hand, foot, mouth every day. Every day you get a status update from school that yet another patient has been done and sanitization is taking place. And then add to that this H3N2. With kids, it's anyways very hard to tell because they fall sick so often. I'm talking about, up till 0 to 5 or so. Do you have any particular guidelines that you want to tell worried mothers like me on what to do? Because half the time we are thinking we've done something wrong and that's why the child is sick yet again.
No, so first thing we all need to know is, you rightly said, this is the season for all the kids to build their immunity. Okay, till 5 years, we expect kids to catch some or the other infection, right? Hand, foot, mouth disease, diarrhea is there. Monsoon season, there will be diarrhea. Then there is URTI, upper respiratory infection. Now, since it has changed its codes, H3N2 is known for, influenza is known for shifting its picture. So the fever is for a long duration, cough and cold is staying for 2 weeks. Kids are not feeling in the element, they're crying in the morning to go to school. Bata nahi sakte, they can't express themselves, but they're not feeling up to it. So the long duration makes us also test kids and adults, and then we come to know this is some new viral which is doing the rounds and anything. But yes, the thing is, danger signs for kids would always remain the same. If your child is playful, active, in between fever spikes, so these days we are seeing 103, 104 fever also. It is not responding to paracetamol, you would have to do cold sponging. Okay, all those things are happening, but the danger signs remains the same. In between fever spikes, if your child is active, he's feeding at least water at the hydration level you are maintaining well, he's peeing well, there's nothing to worry as such. But yes, if you feel the respiratory rate is higher, they're not feeding, the urine output is low, they're inactive, they're not their usual self, then you need to get in touch with the doctor. We normally say first 3 days you can actually self-medicate with paracetamol and hydration and rest. Visit us on day 3. But any day you feel danger sign is there, we are always there for you. Reach out to your nearest pediatrician. Now, second thing you said, is there anything we can do? So prevention in kids is very important and very difficult, both things. You can't really tell your kid to wear a mask all the time. If your uncle or your best friend is sneezing, don't go and hug them. If your sister who's come from school is not feeling well, she's fever, don't go and play with her. You can't tell them all these things, right? So for mothers like you, there's a very clear message. Do not panic unnecessarily. Influenza A comes every year in different, क्या बोलेंगे, in
Avatars,
different avatars, in
mutations.
different places and everything. Yes. So our kids are yet into building immunity. They are learning to fight off all these infections. We have vaccination for it, right? So opt for it if you have that option. But always remember, panic creates or worsens your situation. There's this mother who has been adamant ki ma'am, if you are confident, I will actually not get my child admitted if you feel that she's fine. So show trust in your doctor. Do not unnecessarily start antibiotics. Flu may
Yeah.
antibiotics absolutely have no role.
No role.
And we are seeing kids, I'll tell them there's no need for antibiotic. You just give symptomatic treatment and we'll see after 48 hours. But they'll get it from a chemist or whatever is, pehle se pada hua hai ghar pe, they'll use azithromycin and then augmentin and cefixime. There's no point. The day your child actually needs this cefixime or azithromycin, it will not work on your
Yep.
child.
Yep.
So relax, do not over medicate. This is the time to, stay under touch or in contact with your local pediatrician and let the time pass.
I think that's a good way to wrap this up. What doctors both are telling us right now is that do not worry about what strain this is. Leave those headlines for us to bother about. You worry about symptoms. If you are in the sensitive category, if you're immunocompromised, or if you are undergoing a treatment, please, at the first sign itself, go see your doctor. For kids, etc., watch it out for 2-3 days and then watch out for any other signs as well. Breathe easy. Try to enjoy. Holiday season, festive season is just around the corner. Thank you both for joining us.